Welcome back to this series on shoulder pain. Today, we're looking at the best evidence-based treatments for rotator cuff-related shoulder pain. We'd love to hear about your experience of shoulder pain and what you've been advised. Drop a comment down below to let us know. All right, let's jump right in. If you've got shoulder pain, you are so not alone. It's one of the top reasons people end up at the doctor. And get this, a whopping 70% of those cases get diagnosed as rotator cuff-related shoulder pain. That is a massive number. It just goes to show you how incredibly common this really is.
But, when something is that common, you get a ton of conflicting advice, right? Rest it, ice it, stretch it, get a scan, get a shot, maybe even surgery. It's just a lot, and it can be really overwhelming to figure out what you're actually supposed to do. So in this explainer, we're going to cut through all that noise and look at what the best evidence really says about getting better. Okay, first things first. What even is rotator cuff-related shoulder pain, or RCRSP? Well, think of it less as one single diagnosis and more like a big umbrella term. It covers pain coming from the rotator cuff tendons and all the stuff around them. And this is a really important shift in how we think about it, because it moves us away from searching for one specific broken part and more towards understanding the shoulder's overall health and what it can handle.
And this is where our understanding has taken a huge leap forward. The old way of thinking was super mechanical. You probably heard the term impingement, the idea that bones were literally rubbing on the tendons and shredding them. But the new evidence-based view is way more functional. It looks at the problem as an issue of load tolerance. Basically, the demands you're putting on your shoulder are just more than your tendons can handle right now. And that is a total game changer because it means you're in control. It's not about a broken part needing a fix, it's about building up its capacity. Okay, so if the problem is that the tendon just can't handle the load, what's the fix? Well, this brings us to the most important piece of the puzzle, the absolute foundation of any effective treatment plan.
And this quote right here, it gets straight to the point. The best clinical guidelines we have all say the same thing. The number one first-line treatment, the place where pretty much everyone should start, is a mix of exercise and education. It's not a nice-to-have, it's the core recommendation.
Now, I know that might sound a little backward when you're in pain, right? Exercise, but it hurts. But the science on this is crystal clear. Just resting is not the answer. The goal isn't to stop using your shoulder. It's to slowly, smartly build back your tendon's ability to handle stress. An active approach is absolutely the key to getting a stronger, more resilient shoulder for the long run.
So to help make sense of all the different options out there, let's think about it like a pyramid. At the very bottom, we have the big, stable foundation that applies to just about everyone. That's our education and progressive exercise. Then, a step up, for some people, we have supportive treatments like injections. And way up at the tiny peak, for a very small specific group, there's surgery. For the next few minutes, we're going to build this pyramid together, starting from the ground up. So what does this foundation actually look like in practice? Well, the education part is all about understanding this new way of thinking, that your pain is a signal about load, not necessarily a sign of serious damage. And the exercise part? That's the tool you use to do something about it. The whole goal is to gradually challenge the tendon, bit by bit, making it stronger and more capable over time. Okay, but what if your pain is just so bad that you can't even think about doing exercises? That's a fair question. And that's exactly where the next level of our pyramid comes into play. Injections. It is so important to understand the different jobs these two things do. A corticosteroid injection is really good at one thing, giving you strong but short-term pain relief. Exercise, on the other hand, is all about creating long-term, lasting improvement. They aren't even competing with each other. One's a temporary tool, and the other is a long-term solution. And you know what? The evidence here is super clear. Big studies have looked at this, and they found that when you check in on patients a year later, the group that got an injection is doing no better than the group that didn't. Injections can give you a nice window of relief, for sure, but they don't fix the root of the problem, that load tolerance issue we talked about. So that brings up a pretty important question, right? If they don't help in the long run, are they useless? Should we just skip them altogether? Well, not necessarily. Here's the key thing to understand about injections. It's all about timing and purpose. The best way to use an injection is as a bridge. If your pain is so intense that you just can't start those foundational exercises, an injection can calm things down just enough to let you get started on the active rehab, which is the thing that will actually solve the problem in the long run. Think of it as a tool that gets you to the real solution. All right, so we've covered the foundation, and we've seen how injections can be a helpful bridge. But what about that tiny little peak of the pyramid, the most invasive option of all? Let's talk about surgery and when it might come into the picture.
Okay, the very first thing you need to know is this. For the vast majority of people with this kind of shoulder pain, even many people who have rotator cuff tears on an MRI, surgery is just not needed. Seriously, study after study shows that a really good, non-operative program built on that foundation of exercise and education gets results that are just as good as surgery. So who is a candidate for surgery? Well, it's a really small and specific group of people. We're talking about situations like a sudden, traumatic, full tear from an accident in someone who's young and active. Or maybe for someone who has truly given it their all in a solid rehab program for at least 3 months and is just not getting better. It should really be seen as a last resort, not the first thing you try.
Okay, let's pull all of this together now. Let's map out what this evidence-based path to recovery really looks like for you.
So what are the big takeaways here? First, have that aha moment. Reframe how you think about this. It's not just about damage, it's about your shoulder's capacity. From there, make progressive exercise your non-negotiable foundation. Job number 1. Next, see injections for what they are, a temporary bridge to get you to the real work, not the work itself. And remember, surgery is way up at the top of that pyramid for a reason. It's rarely the first step. And finally, and this is a huge one from the guidelines, you almost never need an MRI or an ultrasound before you get started. A good physical exam is plenty to get you on the right path.
And that leaves us with one final question for you to think about. When you look at your own recovery plan or the advice you've been given, is it built on that solid, evidence-based foundation of education and progressive exercise? Because at the end of the day, all the best science we have points to one thing. That is what actually works.